Now we will explore three agencies that play a crucial role in addressing addiction.
PSA, these agencies address both mental health and addiction, recognizing their relation. Edmonton offers a variety of organizations dedicated to address addiction through support, treatment, and prevention. Our House Addiction Recovery Center is a nonprofit agency that provides a year-long residential treatment program for individuals recovering from addiction. They offer services like counseling, group therapy, and life skills development.
In Alberta, Alberta Health Services or AHS, which is a governmental agency that provides comprehensive support for individuals facing addiction and mental health challenges. They offer a range of services including 24/7 helplines, access to addiction treatment programs, and information resource for the recovery process. In Canada, several organizations across the nation provide governmental services to address addiction through various programs and services. Center for Addiction and Mental Health, or CAMH, is a nonprofit organization. It is Canada's largest mental health teaching hospital and a world-leading research center in addiction. They offer clinical care, conduct research, and provides education and treatment of addiction and mental health issues.
Up next, we will discuss the three programs and services of the agencies mentioned in detail. Here are three programs and services from our House Addiction Recovery Center. First, we have the Residential Recovery Program. They offer men a safe and structured environment where they can receive intensive support in overcoming addiction. It is designed to help individuals rebuild their lives by focusing on long-term fixes. This program includes detox support, individual and group counseling, life skills training, physical fitness activities, as well as spiritual guidance. Next is called Men in Recovery. This program specifically caters to men who are struggling with addiction and have experienced personal challenges in their recovery journey. It provides a supportive environment for men to work through their addiction while focusing on understanding male-specific factors that contribute to addiction. Third, we have individuals and family counseling. They offer personalized support not just for individuals but also for their families. It acknowledges that addiction impacts not only the person affected but also their loved ones. This program helps individuals understand addiction and their roles in supporting recovery. Services include strategies for healthy communications, setting boundaries, coping with emotional challenges that addiction brings to relations. This agency has been offering recovery programs for over 30 years, making it a long-established part of the Edmonton community. The target population for the programs and services at our House Addiction Recovery Center includes individuals struggling with substance abuse. The residential recovery program is specifically designed for men ages 18 and older. The programs are locally based in Edmonton, Alberta, and the organization is known for its outreach services within the community. The focus seems to be primarily on the urban Edmonton area. Outreach services are available, including individual and family counseling, offering support beyond the residential program. Here is the office hours and phone number. Strengths of the program offered includes a year-long residential recovery program, which is one of the few in Canada. The program incorporates individualized and family counseling, which helps foster a strong support network for recovery. The program is affordable, meaning the focus is more on providing access to recovery rather than charging high fees. The center takes a comprehensive approach addressing multiple components of addiction recovery such as mental health support, life skills development, and care. Weaknesses and limitation includes limited accessibility. It is specifically for men, which limits to those who don't fall into this category. Also, it has a capacity limitation, potentially leading to availability concerns during peak demand times. It is locally based in Edmonton, which means out-of-province individuals may face barriers in terms of transportation and accommodation. Improvements and recommendations. Expanding the program to also serve women would allow a wider range of individuals to benefit from the services, making it more inclusive. To address availability concern, expanding the residential facilities would allow the center to serve a larger number of individuals. Introducing virtual programs for those unable to attend in person would definitely increase accessibility. Positive effect of these services. Structured programs assist individuals in overcoming substance abuse, improving long-term health and mental well-being. Continuous support reduces the likelihood of setbacks in recovery, fostering sustained improvements in both mental and physical health. It also helps individuals develop critical skills, promoting healthier and coping mechanisms. What would happen if these programs did not exist? Without these structured recovery programs, many individuals might return to substance abuse due to lack of support. Also, without integrated mental health services, individuals struggling with addiction may experience untreated co-occurring mental health disorders. Absence of these programs could also increase the strain on emergency services and hospitals due to untreated addiction and related crises. Lack of life management and anger management programs could hinder recovery and lead to social instability.
The AHS Addiction and Mental Health Agency have services to ensure that Albertans have the support they need to navigate addiction challenges and improve their well-being. The first service is the AHS Helplines. It is designed to support Albertans dealing with addiction and mental health challenges. It is available province-wide and has been delivering the service since its formation in 2009. The next service is the Community Addiction and Mental Health Services. This program provides in-person support for individuals experiencing moderate to severe addiction and mental health concerns. Service includes assessment, treatments, and follow-up care, collaboration with families, and client-centered care. The service is available in various health centers and community-based clinics across Alberta, also established in 2009. The third service is the Recovery Alberta, which is a newly established provincial health agency in July 1st, 2024, operated in September 1st of 2024. Focused on recovery-oriented addiction and mental health care, they offer services like detox programs, psychiatric treatment, and rehabilitation programs. These programs are inclusive and is designed to support diverse ranges of individuals struggling with addiction and mental health challenges. Services are available to all gender, all age groups, and accessible to all racial and cultural groups, with some programs offering culturally specific support for Indigenous, immigrants, and refugee population. These programs are provincially based, meaning they are available throughout Canada. AHS Addiction and Mental Health Services operate across Alberta, serving both rural, like many small towns and remote communities, which relies on telehealth services, helplines, and mobile outreach programs to access care, and urban communities like major cities like Edmonton, Calgary, Red Deer, and Lethbridge. They have more specialized facilities, including detox centers and psychiatric treatment options. Outreach programs bring addiction and mental health care to remote and underserved communities. Virtual support and telehealth options help eliminate geographic barriers for those who cannot travel. Strength. The services are free and accessible. They are publicly funded, no cost for Albertans residents, removing financial barriers and ensure that people can access when needed. They have comprehensive care, which covers prevention, intervention, treatment, and long-term support. They are specialized and inclusive. They support diverse population, recognizing different cultural backgrounds and unique needs. It is innovative and evolving. This means that there is constant improvement to service, continuously improving to better address addiction and mental health concern in Alberta. The weaknesses and limitation of these programs is that it's limited in rural access. It also has high demands and wait times and lack of resources for some groups, like youth services and non-substance addiction need more focus. Improvements. Expand rural outreach, reduce wait times with more funding and staffing, increase awareness to reduce stigma, develop more youth-focused programs. Positive effect of these services. They prevent worsening addiction issues by providing early intervention. They also reduce overdose rates by offering detox and harm-reducing strategies. They support long-term recovery through relapse prevention and ongoing counseling. They also have improvements for overall mental health by addressing co-occurring conditions like anxiety, depression, and trauma. What would happen if these services didn't exist? An increase in addiction rates, higher rates of overdose, and more drug-related fatalities, strain on emergency services and healthcare, as without early intervention, addiction-related ER visit and hospitalization would increase, overloading the healthcare system. Also, greater economic and social consequences as addiction impacts employment, family stability, and community safety, leading to higher unemployment, homelessness, and crime rates. Now we will explore the three programs of the Center for Addiction and Mental Health, also known as CAMH. The first, we have Medical Withdrawal Service. This program helps safely manage withdrawal from substances like alcohol and opioids. It is located in Toronto and has been established for over 50 years of service. The key features of this service is that it's a 24-hour medical supervision, detox services with medication, counseling, and referrals, and they focus on harm reduction and stabilization. This ensures individuals receive the medical and emotional support they need during the withdrawal process. Next is a Youth Addiction and Concurrent Disorder Services, a program specifically designed for youth aged 14 to 24 who struggle with both substance and mental health challenges. It is also based in Toronto and has been running for over 20 years. The key features of this program is family therapy, group counseling, and psychiatric support. It also has a holistic approach in addressing school, family, and social challenges and focuses on early intervention and long-term recovery. By targeting youth early, this program helps prevent lifelong struggles in addiction and mental health issues. Finally, Concurrent Addiction and Patient Treatment Services provides inpatient treatment for adults facing addiction and mental health disorders. It is also based in Toronto and have been running for 30 years of service. The key features of the service is detox, individual group therapy, and relapse prevention. They have structured inpatient care for those needing hospital-based treatment and discharge planning to support long-term recovery. This program ensures individuals receive comprehensive, round-the-clock care for complex addiction and mental health needs. CAMH offers several specialized programs tailored to different age groups and needs. By addressing different age groups and backgrounds, CAMH ensures that individuals receive the appropriate level of care.
Weakness and limitations of the programs and services. Geographic location. There might be limited access for individuals residing outside Toronto. Next, resource constraints. High demand for services can lead to wait times. Cost considerations. Some specialized programs may involve costs, which could be a barrier for certain individuals. Some improvements and recommendations. Developing outreach programs and partnership with community organizations could extend CAMH's reach beyond Toronto, providing support to underserved areas. Telemedicine services. Expanding virtual care options could reach individuals who are unable to attend in-person appointments, potentially increasing the number of people served. Here are other recommendations: enhancing capacity, financial assistance, and imposed community-based initiatives. What would happen if these programs did not exist? Increased stigma. Fewer awareness campaigns could result in more stigma, preventing people from seeking help. Lack of family support. Families would not have specialized resources or programs, leading to isolation and added stress. Worsening conditions. Individuals might face untreated mental health and addiction issues, leading to worsening symptoms. Lastly, disconnection from support. Lack of community-based care might leave individuals feeling isolated in their recovery process.